Thank you for joining us for this virtual community town hall addressing COVID-19 in the greater Fredericksburg region. My name is Xavier Richardson. I am the Senior Vice President and Chief Corporate Development Officer of Mary Washington Healthcare. Since the COVID-19 pandemic reached the Fredericksburg region, we have been humbled and overwhelmed by the outpouring of support from our community. And still, many of you are asking what more you can do to help our caregivers on the front line. I invite you to visit give.mwhc.com and consider a donation to the Mary Washington Healthcare Associate Assistance Fund. This fund was created by our associates or employees, and it provides emergency financial relief to fellow associates. In this great time of uncertainty, many of our associates' partners and spouses have been furloughed, creating additional financial hardships in their respective households. Your support will help families with critical expenses like housing and food. Thank you for your generosity and caring. And now, I'll turn the program over to our moderator, Lisa Henry, Director of Corporate Marketing and Communications, who will introduce our panelists.
Thank you, Xavier, and welcome to our panelists. First, we have Dr. Mike McDermott, President and CEO, Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer, and Eileen Doman, Chief Nursing Officer. Mike, we'd like to start with you.
Great. Well, I'll just start by thanking everybody for taking some time out of their evening to tune in. I'm Mike McDermott. I'm the President and Chief Executive Officer of Mary Washington Healthcare. Our team has enjoyed having these town halls with our community, really to be transparent and keep everybody up to speed with what it is we're seeing in the Fredericksburg region and Mary Washington Healthcare as we have navigated the COVID-19 crisis. I'd like to start by sharing with you some data, if we could bring up the graphic from one of our internal dashboards that we use here at Mary Washington Healthcare. This shows our current status. We have 15 inpatients in our hospitals who have tested positive for COVID-19 that we are currently treating. We have 14 patients in our hospital who are under investigation. These are patients who have signs and symptoms or some probability of having COVID-19, but we're still awaiting their test results to return. We have 47 patients who have tested positive for COVID-19 that we have discharged back home. We have had 10 patients who have been COVID-19 positive who have passed away and succumbed to the disease. Down on the bottom right of this graphic is our testing status as we've gone through the COVID-19 crisis. On the left of those bars are the most recent dates. As you get further away to the right, those are dates in the past. And it shows our testing status for every day for the past several weeks. And you can see the bars to the left are higher, meaning we are performing more tests than ever. Our testing capability has improved significantly in the health system. If you remember when we first joined you weeks ago, we were talking about not being able to test every patient that even presented to our facility that had signs and symptoms of COVID-19. Now, if you're a patient who presents to our facilities with signs and symptoms of COVID-19, every patient gets tested. We have the capability to perform hundreds of tests on any given day in our community. It's one of the reasons why we have started drive-through testing sites to allow some of our community physicians in their private practices, if they write a prescription, we have safe ways to have those patients be tested for COVID-19 in our community. So we're doing more testing than ever. Also in those bars, you can see some blue in the bars far to the left. Those are the tests that we're still awaiting results to come back on. Up above those bars are some graphs. In those graphs, the yellow line shows the number of patients that we've had hospitalized over the past several weeks. There's some red lines in there that describe the number of patients who have required intensive care unit care over the past several weeks. And then the green lines are the total number of patients who we have tested on any given day that have been positive. And as you can see, looking at those graphs, They seem to show a peak that has happened over a week ago, and there's been some stability and flattening in the week since that peak. And so we are seeing kind of a stable amount of patients that are requiring hospitalized care and intensive care unit care at our Mary Washington healthcare facilities here in our Fredericksburg region. That is one of the reasons why, as the governor has allowed his executive order, which banned scheduled medical procedures, he's going to allow that to expire here at midnight tonight. Next week, we are planning on allowing some of those patients in our Fredericksburg community who have had medical needs that have had to have been delayed for the last 6 weeks. We're going to allow some of those patients to have their medical needs met by having their scheduled procedures performed as we move into the future. And so that's just a quick update of where we stand here in Fredericksburg.
Thank you, Dr. McDermott. Dr. Newman?
Yeah, as Mike just reported, we're pleased to report that we will be starting scheduled procedures on this coming Monday. We've done a lot of planning around doing that in the safest fashion possible, and there will be some changes to how we traditionally have scheduled some of these procedures in the past. We have a team of physician leaders, nursing leaders, and operational leaders that are meeting on a at least weekly basis, if not more frequently, that first assess, are we safely able to proceed in the following week? And things that we look at is the medication supply, our capacity, our staffing capabilities. Do we have adequate number of masks and gloves? And we're ensuring that we are not diverting any supplies away for caring for our coronavirus patients within the hospital in order to be able to safely proceed with these procedures. We're asking patients to meet with their physicians and schedule procedures roughly 14 days in advance. That gives us time to go through some of the process changes. Preoperative testing can occur somewhere between day 7 and day 14. Roughly the week prior to a procedure, we're asking that our patients self-quarantine, and that is really to prevent them from getting infected by going out in the community and to ensure they're safe when they come to the hospital or to our ambulatory surgery center for the procedure. Roughly 4 days prior to their procedure, we're going to be having patients tested through one of our drive-through sites that we have in Stafford, King George, and here in Fredericksburg to again ensure that they are not asymptomatic carriers. You may have heard about that in the news, that some people could be infected with coronavirus and may not know it. So we're ensuring that you're not an asymptomatic carrier and you don't have the illness. And then one last screen will occur on the day of your procedure. When you come here, you'll have your temperature checked. You'll be screened for signs of coronavirus. And we will also confirm that your lab result is negative at that time. And then we can ensure that it's safe to proceed with the procedure. And again, many of these procedures are medically necessary. They've been delayed for upwards of 6 weeks for many patients. So it's really important to continue to delay that kind of care for weeks or months further. So we're in a point now where we have the safe capacity, we have the safe supplies, and we can keep you safe when you come to our facilities in order to give you that care.
Thank you, Dr. Newman. Eileen?
Chris talked about us being able to resume some scheduled procedures, and I think there's a little bit of a misnomer there out in the community about that the hospital is very busy and that we're overrun with patients, or even what we've heard from some is we're overrun with COVID patients and that it's not safe to come to the hospital, and nothing could be further from the truth. Mike shared with you what the numbers are as far as the number of patients that are in our hospitals with COVID or being tested for COVID. When we have a COVID patient that's in the hospital, they are on an isolation unit. They are isolated away from the rest of the hospital. And so they're on a specific unit. Those units have all been especially treated that they have what we call negative airflow, which means that the air that circulates on that unit never crosses into the rest of the hospital. It's immediately exhausted out into the air and into the environment where it can be diluted. We're doing things like when people are coming into our hospitals, we're checking everyone's temperature, we're having people mask. So we're doing everything that we can to make sure that we make our hospital be a very safe place. Unfortunately, what we're seeing is less people coming to the hospital, and the concerning part of that is people that may need to actually come to the hospital. So in our emergency departments, we're seeing about 50% of the volume that we usually see. People didn't get cured of chronic illnesses through COVID. Particularly, Chris was sharing some numbers with us earlier today, heart attacks and strokes. We've seen a significant decline, 40%, I think you said,
decline, yeah.
less heart attacks and strokes in the last month as compared to the same month last year. Now, nothing's happened with COVID to cure heart disease or to make those things not happen. And what we're also hearing across the country is an increase of deaths that occur at home. So it causes you to wonder and to be concerned, are people not coming to the hospital because they're afraid? And are they paying that ultimate price of not getting the care that they need? And so part of our message tonight, a very strong message, is our hospitals are safe to come to. We are taking every precaution that we can, and we're used to doing this. I mean, the pandemic and COVID is new to us, but we are always doing things to prevent infection and to keep our associates and our patients safe. So when we talk about starting these scheduled procedures, Chris outlined the process. It's a very detailed process for us to consider every single case, whether it truly is safe for us to do that. And if something were to change and to raise a concern, we could stop those procedures as quickly as we did when we had to 6 weeks ago. So I don't want anyone out there being concerned that it's not safe to come to the hospital. I consider the hospitals to be the safest place you can be in our community. And it's important that people take care of themselves, and when they need medical attention, that they're seeking it. Whether it's the hospital, whether it's their doctor's offices, people need care, and they need to make sure that they're getting that care.
Thank you, Eileen. We're getting a flood of questions in, and a few of them have come in already about testing, a variation of information for testing. They want to know more about should they still be getting tested if they have symptoms, and also about antibody testing. Dr. Newman, could you tackle that one, please?
Yeah, certainly. So a lot has changed in our ability to test for coronavirus in the last few weeks. We now have the ability to test hundreds of patients each day for coronavirus. So there's two groups of patients that we're looking at testing with our PCR genetic testing, which is it tests for active disease, active shedding of virus. So patients who are symptomatic, people who have signs and symptoms of coronavirus, we're really encouraging to get tested through one of our drive-through sites. And we have 3 locations regionally here. We are also going to be testing most of our patients who are scheduled for procedures in the upcoming weeks to ensure that they are not asymptomatic carriers. So those are the 2 types of patients that we were testing in the outpatient world. Within the hospital, we're obviously able to test everyone who has signs or symptoms or concerns for COVID or coronavirus. We are working on improving our ability to do in-house testing so we don't have to send out these tests and get a 2 to 3 day wait before we know the results. So for hospitalized patients, we're working on expanding our capacity to test in our own lab with a 45-minute turnaround time. So we're quickly able to tell if somebody has COVID and then treat them appropriately. The antibody tests are something that is new, and you've probably heard a lot of that about it on the news, quite honestly. We do now have ability to test for antibodies here at Mary Washington, and we've received recently 6,000 tests this week to be able to start antibody testing and serum testing. A couple important parts about antibody testing. This is not to see if you actively have coronavirus. This is not a test that tells that you have an active infection. This is more of a surveillance mechanism to say, did you have it in the past? Have you been exposed? And do you have antibodies to coronavirus? We're not quite sure the most responsible way to use this test going forward, and we are conferring with our public health officials and experts such as Johns Hopkins University. There's a team through the VHHA here in Virginia looking at how we can safely and responsibly use these tests and use the results that they get responsibly and know what to do with them. We'll probably be using them first to look at some of our frontline staff, our docs and nurses who've been involved in the care of coronavirus. We may be looking at some of our city workers and some of our high-risk first responders to see what their status would be. And then we're hoping to have the ability to open up this more broadly to the community. The one thing that's very important to know about the antibody tests is there's many antibody tests already out there on the market, but the results are unclear of the validity of them. The test that we have here at Mary Washington is one of the few tests that has FDA approval through something called emergency use authorization. It's an ELISA test that is accurate in really assessing the antibody status. So before you get tested, make sure you're getting the right test and you're getting an accurate test going forward. And there's no rush in getting these tests performed because, again, these are not for active disease or active infection.
A couple of follow-ups to the testing question, Dr. Newman. One of them was asking, is there any PCR testing with same-day turnaround here in this community? And are we concerned at all, have a heightened concern for anybody who lives in the Spotsylvania area after the reported outbreak at a local grocery store?
Okay. Yes, so the in-house testing we were talking about, that does have a same-day turnaround time, 45 minutes. We're using a lab capability through a company called Cepheid, who you may have heard on the news, but there's a shortage of the cartridges that we need to run those tests. So we have a limited supply at this point, and we're working very hard to expand our capabilities in-house to get these quick turnarounds. As we send out to LabCorp and Quest and some other labs, it's been running about 24 to 72 hours is what a turnaround time on that. We're not out of the woods. As Dr. McDermott spoke, we're very optimistic that we're on the downside of this curve, but there are still local outbreaks as we've seen. We have not seen a significant outbreak in a skilled nursing facility or homeless shelter or some other high-risk populations, and that still could occur. So we still have to be hyper-vigilant. We still have to be following social distancing guidelines. Even as our economy and our society begins to open up, we do have to be vigilant going forward to make sure that we're safe.
One last testing question, but I'm sorry, do you want to?
I would just say I want to congratulate everybody in our community for doing such a great job of following the stay-at-home orders and the social distancing protocols that we've all been asked to do. We can see here on our local data how that has affected what the healthcare needs on our health system. Yes. We have not seen a surge like they've seen in Italy or in New York City, and that is largely because members of our community have taken the stay-at-home orders and social distancing so seriously. So, number one, congratulations to everybody. Yes. And I also want to differentiate a little bit between our move to restart some scheduled medical procedures. That is not saying we stop social distancing and the stay-at-home orders. Totally different. We're talking about some patients who have healthcare needs to improve their health outcomes, being able to receive that care so they can have a better health outcome. That's different than saying go about normal activities and don't pay attention to social distancing. So I still encourage everybody to wear masks when out in the public, follow social distancing protocols, and stay at home if you can. Those things are all very, very important. I do also want to reiterate, though, as Eileen said, if you have a medical need and a healthcare need, please seek care. Our hospitals are exceptionally safe facilities, exceptionally safe. We follow sterilization and infection control protocols like no other industry. We have abilities within our buildings to divert airflow, negative pressure, HEPA filter, all of those things that other buildings do not have the capability to do. So our hospital is actually one of the safest places that you can be at this time. And so if you have a need for medical care, please seek medical care at Mary Washington Healthcare. We are here to care for you.
Absolutely.
Thank you, Dr. McDermott. I'm actually going to switch gears here, and Eileen, ask you. We've had some questions about our staff. Have we seen positives in our staff, and what's happening with that?
We have, and so to date, we've had 14 between our staff and our clinical staff and medical staff that have tested positive. All of them are making a good recovery, and we're excited about that. The thing that I would tell you that we're most excited about is that we have not had an associate or a member of our medical staff test positive in the last 2 weeks. And that 2 weeks goes back to the time when we were at the highest volume of COVID patients in our buildings. And so you would say, well, then what is that about? Well, that's about all of the measures that we put in place and the care that our associates and our medical staff are taking to make sure that they are 100% of the time very cognizant of those good infection prevention practices. And on top of that, we've added lots of insurances. So I mentioned the last time we spoke about our infection prevention coaches and our DOFficers, extra staff that we have on all of those isolation units to actually be a second set of eyes for those nurses and those medical staff when they're putting their PPE on or they're taking it off. And so we really have felt, we're very thankful that our staff, everyone has taken things so seriously. We believe that the measures we put in place have been effective, and indeed we're very happy to see that it's been 2 weeks since we've had any of our associates or our medical staff test positive.
Thank you, Eileen. We've had a few questions around standards of care for nursing. Can you talk a little bit about where we are in the standard of care levels in Virginia and what we're doing to cross-train and prepare our nurses?
So we've done a lot of work, and we've had the benefit of hearing from other countries that dealt with the crisis before us, then also in New York. And so the biggest message that we've heard from all those places is that your intensive care unit, your ICUs, that volume will go up very high. And so very early on, we put plans in place that would allow us to double our intensive care unit capacity. So at Mary Washington, that means we had a plan to go from our 38-bed ICU up to 77 beds. At Stafford, to go from 6 to 10. And the way that we could do that is we needed to first find the physical space where we could put those patients if they needed that care. And then the second was who would be taking care of them. And so the physical place was almost the easier part of that work. Then we had to look at who would be the nurses providing that care. And we looked at all of the nurses in our organization, particularly in the places that we're seeing a decrease in volume. So our OR nurses, our recovery room nurses, some of our step-down unit nurses, and actually provided intensive training for them over the last several weeks so that they could be available if we saw that increase in ICU census. It would also mean that we would change the way we provide ICU care. So it doesn't mean that I can create an ICU nurse in a matter of 2 weeks. That takes a very long time of intensive training and experience. But what it would have meant is that we would have changed our model. It would have been an ICU nurse working with probably 2 nurses who had had some more additional recent training, and they together as a team would have been taking care of a group of patients. The good news is that we haven't had to do that. We've expanded our ICU a little bit into another physical location at Mary Washington, and just because of overall ICU volume, but we haven't had to use any more than our usual number of ICU beds, which we're very thankful for, but had we needed that, we would have been prepared to do that.
We've had some questions about PPE, so I'll open this up to whoever wants to speak to this. They want to know, do we have enough first, especially with starting additional procedures next week? And should all the patients start wearing masks in the hospital?
Yeah, I can speak to that. So we have a stable supply of PPE at this point. That does not mean, many of these masks were intended for single use, so you use it one time and then throw it away. That does not mean we're able to do that. Our health system's not able to do that, nor is any other health system in the country or the world at this point. And I don't see that portion getting alleviated anytime soon. I think there's just such a demand on these supplies in the world. But I do think we have safe amounts of PPE. And as Eileen had mentioned, we've had no affected staff members in the last 2 weeks. So I think we do have a safe amount. And we do look at these supplies very carefully on a regular basis to ensure that we do have adequate supplies to resume some of the scheduled procedures at the same time. The state of Virginia has now received an additional supply of some of these vital supplies. And we don't know how they will delineate those to the health systems and healthcare providers within the state yet, but there are continuous supplies coming in. It's just not, when you hear about the shortages now, we're not able to use things for single use at this point, but I do think we're in a safer position than we were a few weeks ago.
But you asked the question about patients wearing masks, and we are actually now asking that anyone that comes into our buildings wear a mask, and for a patient, we are asking patients to wear a mask. So when they're being taken care of, so when they're in their room, their hospital room by themselves, then no, we don't expect a patient to wear the mask, or they're sleeping, they don't need to wear the mask. But when there is a caregiver that's in the room with them, so when the nurse or the respiratory therapist or the physical therapist or a physician come into the room, that to be prepared that the person coming into the room is going to ask the patient to put on a mask. We're going to provide those masks to patients, and that's really meant to decrease the potential transmission of virus. Because people may indeed have and are asymptomatic. And so we're trying to just take every precaution. And so now we are asking that essentially everybody in our buildings is wearing a mask. And for patients, it'll be the same mask that they'll see the clinicians taking care of them wearing.
And again, I would just encourage everybody as you go out in public to please wear a mask, right?
Yes.
And again, you know, the idea behind that is if you're an asymptomatic carrier or do not yet have symptoms, but you have the virus in you and you might be shedding it, by wearing a mask, you will shed less of that into the environment you're in. You will decrease your spread of droplets. And so, again, wearing a mask, it's a sign of caring for those others who are around you in that same area you might be in, whether it's the grocery store or some other place out of necessity that you have to be at. If you wear a mask, it's an outward sign to the others who are around you that you care for them. And so I think it's a very positive message. I encourage everybody to wear a mask when you're in public.
We've been getting a lot of questions about our opinion on social gatherings with social distancing. I think isolation might be getting to some folks, as you can imagine. And so some of those questions include, you know, can we collect in parking lots in our cars and visit with one another? Is it safe to do these things? Should we wear masks? Should we be prepared? How could we safely see each other and safely commune as a society, and what your opinions are on that? I'll start with you, Dr. McDermott.
Well, I would say, you know, our society has gotten very creative in ways to stay in contact with one another as we've all been impacted by COVID-19 over the past several weeks. The increase in video conferencing software, the Zoom meetings, the Google meetings, the FaceTime meetings that are all out there. All of us have participated in those in one way or another, whether it's with our loved ones or friends that we want to stay in contact with. So I think those are great ways. Leverage technology use in any way that you can to stay in contact with those you care about and those that you love. Now, whether you meet in a parking lot and stay in your cars in some way, I think there's lots of creative ways where we can all have contact with one another and maintain our friendships with one another. And so I just encourage you to, however it is that you're staying in contact with those that you care about, please pay attention to the social distancing that we know helps protect everybody from the spread of this virus.
And wear a mask.
And wear a mask.
Excellent. We did have a question about how good is communication, and they said in quotes, please be honest, between the hospitals, the county EOC and emergency manager, state EOC, what's happening there, and is there good relationships between the hospital and the government officials?
Yeah, I mean, the answer to that is communication is very good, and it's very frequent on all of those levels, whether it's with the state, our localities, other facilities in the region that are impacted. I think there's just fantastic communication going on, and everybody's sharing very, very honestly and transparently with one another what their needs are, what they see that's going on, questions they might need to have answered, ways that we might need to come together and put our heads together to find a good way forward. And so I just think there's been fantastic communication at every level that I've seen as everybody has faced this crisis together.
Great, thank you. We've gone back to a couple more test questions, so I'm going to come back to you, Dr. Newman. There's been some questions around false negatives, false positives. What is the data on that? And whether or not you can be positive after you've recovered.
Yeah. So there's a lot of confusion. We don't have all the answers on this. Any test you do in healthcare, there's always going to be false negatives, false positives. There's no perfect test out there. There have been some reports of false negatives when we're testing for coronavirus. So a lot of healthcare comes down to clinical judgment. So when we see a patient here at the hospital that has signs and symptoms of coronavirus, and there are a lot of specific radiologic findings, symptoms that go along with that, and if they test negative, we're still concerned in treating those patients as if they have coronavirus. When we look to resume the scheduled procedures, one of the reasons we are testing, but we know that that's not a 100% test to say you're 100% free. That's why we're doing the symptomatology checking, the temperature checking, and recommending a short period of self-quarantining as well. And all those things added up give a higher level of safety that you're not infected when you come into one of our facilities for a procedure. But there really is no perfect test for any of these kind of things.
Yeah, I would say, it's beyond the scope of our town hall to give a statistics class on sensitivity, specificity, positive predictive value, negative predictive value, disease prevalence in communities. But every one of those factors is important when you start talking about specific tests, whether it's genetic tests or the antibody testing. Yeah. And that's why it's very important. I encourage you, if you're very interested, read about that on the internet. There's lots about the statistics of what goes into evaluating these tests. It's why when you choose to have a test performed, you want to be very confident in what it is that test is looking for and how it's being performed. It's one of the reasons why at Mary Washington Healthcare, the antibody test that we are looking at using is a very high quality enzyme-linked immunoassay test that requires very sophisticated equipment to run. Yeah. And so I would be careful out there in the testing world. There's a lot of stuff floating around out there, but all of those very specific statistical factors are important when you start talking about what is how good is a test.
Yeah.
Thank you. There's been some questions on how we're treating patients and where those patients are. So the first question was, are we seeing COVID-19 patients at all the hospitals in our market? They said all three. We can't really speak to Spotsylvania Regional since they're not part of our system, but the question was asked. And are we seeing children with COVID-19?
Yeah. So we are seeing COVID patients at both Stafford Hospital and Mary Washington Hospital. Can't speak specifically, but I suspect they're treating patients at Spotsylvania Regional as well. Children, we are not caring for children here with COVID, but I do know that at Children's Hospital, they are hospitalizing and treating patients with coronavirus. This particular virus seems to be less virulent for children, which I think is a blessing, but they are not completely immune to being sick from coronavirus. And what was the other part of the question?
Our treatments.
Oh, their treatments, yes. So right now there is a lot in the news about some promise from one of our antiviral drugs called remdesivir. We have been using that as part of the study from the very beginning here at Mary Washington. So that is part of our standard treatment for coronavirus. Another announcement that we're able to make tonight is that we have been approved to start convalescent serum treatment tomorrow through the study under Mayo Clinic. So we'll be able to do that here in our community. And again, what that is taking the serum or the plasma from a patient who has had coronavirus and recovered, and that's where the antibodies are, and then infusing it in a patient here at the hospital who's critically sick to help boost their immune system and help clear the virus out of the system. We get the supply through the Red Cross. They are managing the supply of plasma. There does appear to be a significant backorder or shortage of this. So if you've had coronavirus and you've recovered, really highly encourage donating blood and plasma so that we can treat other patients going forward. But the Red Cross put out an announcement, I believe today, that said they've seen about a 5-time increase in their supply. So we're really hoping that we're going to be able to open this up to people who are critically ill in our hospitals.
Yeah, pretty exciting.
Yeah.
Thank you. It is exciting that we're right on the leading edge with all of our testing and treatment. We've had a question that some other medical professionals have reported this, and are we seeing this, of otherwise healthy people having clotting or heart issues, and what that might be happening in our community.
Yeah.
Part of the
Coronavirus does appear to be causing a hypercoagulable state, causing blood to clot. And we are, even people who have had mild or less symptomatic disease, young people, there are reports over the weekend of increasing numbers of those individuals coming in with heart attacks and strokes. So that is happening. I can't specifically speak to say if it's happening other than anecdotally here in our community. We haven't studied that, but there's more and more reports of this being a significant concern with coronavirus.
Thank you. One of our viewers asked to clarify that our nurse advice line is recommending people go to our ER at Lee's Hill, which is a freestanding emergency department. And is that a location where people could seek care if they're having symptoms of COVID-19?
Absolutely. Any of our 3 emergency departments. So the Lee's Hill Emergency Department, the Emergency Department at Stafford Hospital, or the Emergency Department at Mary Washington Hospital. All of those emergency departments are fully capable to see a patient with any healthcare needs. But if you think you're having symptoms or any kind of medical situation, please, we very much would welcome seeing you at the emergency department and want to be able to take care of you.
Thank you. And the next question was, people want to still donate. They still want to give in some way in their community. We've had a couple questions around that. One being, is there a way to provide innovative ideas to Mary Washington if there's some ideas out in the community, like 3D printing or other things like that?
We actually have created now an innovation council within the health system because we have had so many offers from people in our community, as well as some of our own associates have come up with some pretty creative ideas trying to help us meet our needs. And so this innovation council has been meeting. What they're looking at is some of those offers that have come in, investigating them, vetting them, creating prototypes, testing them. And so if you are somebody that's in the community that has an idea that you'd like to offer, if you go to our website, then there is a link there for the Innovation Council, or the Innovation Council, and you can submit your idea. And then we'll be back in touch with you and walk through the steps of what the council needs to see so they can evaluate your idea. But we would welcome those, and that's why we created the Innovation Council.
And for those who want to know the website, they could go to mwhc.com and click on the COVID-19 banner. Under the donations page is where we can enter your information for that council. Thank you, Eileen. There's some questions of folks who are saying, I'm staying at home, I'm doing what I can. They're nervous about coming back, nervous about getting out of the home, and they're worried about staying healthy. How could they stay at home and still boost their immune system and avoid some of those problems of just sitting on the couch?
Yeah. Exercise is critical, and there have actually been some studies showing that fitness levels and exercise levels can help you prevent from getting some of the serious signs and symptoms of coronavirus should you be infected. So highly recommend just watching your diet. I think so many of us are quarantined at home and easy to reach for unhealthy food while we're there watching a Netflix marathon. So we really have to be cautious about that. And then exercise, whether it's at home or safely socially distanced outside. I think those are 2 very critical pieces to stay well.
And others have said, I have a lot of anxiety. I'm nervous for going out. What kind of other options for healthcare have we considered or are using here at Mary Washington Healthcare so that people can still access care even if they can't come into the hospital or don't want to?
Want to talk about telehealth?
Yeah, so
Yeah.
the one thing that this pandemic has done is really boosted our capability, not just at Mary Washington, but across the country for telehealth and video visits and video care. So highly encourage folks that maybe feel concerned coming out, still seek access to health care. There's many creative ways that we can see you either telephonically or through video chats. And the technology is very, very easy to use. This is not something that is difficult for people to learn how to use. And most of the patients that have been using this, and our physicians and nurse practitioners and physicians' assistants and other caregivers on our side, have found that it is very useful, and they enjoy using this, even though they were maybe reticent at first.
So I think the best thing to do is, if you have some of those questions about should you be seeking care, is calling our HealthLink nurses, because those nurses are specifically trained with triage protocols to be able to direct you. So having that conversation with that HealthLink nurse, and if the agreement is that yes, we do think that you should seek medical care, and it's not through an emergency room, maybe it is through a doctor's office, then the HealthLink nurses can actually recommend and let you know what are those physician offices that are offering telehealth as an option. So you may not necessarily have to leave your home, but our HealthLink nurses are a great resource.
And we have same-day availability for either in-person visits or telehealth visits. So there's no access problems. We can see you day of many times.
And we've come back to a couple of more test questions. One in particular speaks to, who is eligible for a test? How would they go about getting one? And the other question was, are we ever going to test asymptomatic people?
Yeah. So at this point, we're recommending testing of symptomatic patients at our drive-through testing. As far as asymptomatic patients, we are doing that at this point for, like I said earlier, the preoperative screening to ensure that you're not an asymptomatic carrier of the illness. We are using testing in other specific areas as well. We're looking at using it for labor and delivery because that's an area of risk. Prior to heart surgery and some other urgent issues. And we have a behavioral health hospital here that we're concerned about if somebody goes there and has the illness spreading it. So we are testing everyone going to Snowden, our behavioral health hospital at this point as well. As far as the serum antibody test, we have not made formal recommendations on that, but we suspect that our public health officials, both locally and nationally, will have some advice on how to responsibly use those tests within the next week or so.
But if you're having some of those symptoms that you've heard us talk about that respiratory symptoms that could indeed be COVID, all you need to do is work through your physician, because we just need a physician's order, and then calling our centralized scheduling area can get you scheduled for an outpatient test. Often those can be done same day,
Yep.
And you can have that test done. So it just takes a physician's order and scheduling the appointment.
So we've had a lot of questions about isolation and getting together and socially connecting here on our live Facebook Live. Someone has asked, and I think Dr. McDermott, this will be good for you since you were at the recent Governor Northam's recent press conference. Can we clarify what is opening and not opening? What should people should they be doing social gatherings, or should we still be doing stay at home?
Well, the only thing that's expiring tonight is the governor's executive order banning non-urgent medical procedures, the closure of dental offices, and I believe veterinary offices throughout the Commonwealth. And so the expiration of that executive order tonight just allows those things to restart so people can seek important dental care, that their pets can receive the care that they need, and that patients who have medical needs can get those medical needs met on a scheduled basis. And so those are really the only things that are changing by the expiration of this executive order tonight. All the other governor's executive orders with closures of certain businesses, restaurants, the stay-at-home orders, all of those remain intact. And so it's important, I think, for everybody to recognize that. All of those other executive orders are still very important for us to maintain the level of control over the coronavirus that we have achieved in the Commonwealth so far.
Thank you, Dr. McDermott. One viewer is asking, are there any opportunities to volunteer at the hospital now that some non-emergency procedures are starting again?
No, we are still limiting access to our facilities for everybody's safety, and so we do not have new volunteer activities at all yet within our facilities, and I'm unable to predict even when those would start back up again. And so this isn't about this is not even about business as usual for our healthcare facilities in any way, shape, or form. It's just we know there are patients that have medical needs that have been delayed and aren't being met, and it's important for them to have good health outcomes to start to have those medical needs be addressed now.
Yes.
That's really the only thing that's changing here.
And would we have the ability to halt elective surgeries if we see a change in the community?
We're going to be monitoring the data every day. I know, there's still a lot of uncertainty out there, and when there's uncertainty, it creates anxiety, it makes people uncomfortable, and I understand that. We are being very data-driven here at Mary Washington Healthcare, and we are following the data and reacting to it. And if we see a change in our situation, the good news about scheduled medical procedures is we can stop them very quickly. We can tell the patients who are supposed to come in tomorrow, do not come in tomorrow. So we can shut them off almost immediately. It takes a lot longer to turn them back on because there, as Dr. Newman described, there are preoperative testing needs and requirements in order for you to come in and get that procedure performed that need to be met. But yes, we will be following the data, and if there's ever a need for us to stop the procedures again, we can do that very rapidly to build capacity we might need for other needs, including caring for COVID-19 patients.
I'm getting close to the end of the list of the questions here, so we have heard a couple of times on here that people are concerned that the hospital is a little overrun. We've said this more than once tonight, but I think we should say it again. Talk to us a little bit about what people would expect when they come in for a scheduled procedure or scheduled surgery or for ER or other services.
I would say our hospital is not overrun in any way, shape, or form right now. And the very specific area of the hospital where we are caring for COVID-19 patients is isolated. It's completely separate. Like we talked about, it's airflow, the negative pressure, all of that stuff. That air never circulates anywhere else. It's a very, very separate place, isolated. And so if you're coming in for a scheduled procedure, you're going to be entering a facility that is exceedingly safe to care for you and your healthcare needs.
Well, and you're going to walk in the door, we're going to check your temperature. We're going to ask you to put on a mask. If you've got a loved one with you, we're going to get you settled as far as the patient. So whether that's in through the emergency department, we're going to get you to that emergency room where specific bay where we can see you, and your loved one will leave you there. And we'll be able to provide your care. If you come in our front door, we're going to check your temperature, we're going to give you a mask, we're going to get you to the place where you need to have care. So if that means it's next week for a scheduled procedure, you'll be taken up to the pre-procedure area where the pre-procedure work will happen. So you would see things look pretty consistent with having your temperature checked, being given a mask, having your family not be with you, and then us getting you to the place where you need to have to receive your care. But it is very, very safe. We want you to be here, and we want you to feel safe knowing that we're prepared to provide the care that you need, and you're in a very safe place.
Thank you. A couple last questions. There were some clarification questions on what procedures are actually opening. Does that include screenings like mammograms and colonoscopies?
Yes, it does. So there are a few restrictions at this point on procedures that we're not going along with at the very initial phases here. So one of those would be if you're requiring some care after your surgery at a skilled nursing facility for rehabilitation or a other kind of rehab unit, we're not recommending those type of procedures at this time. If you're expected to require monitoring in one of the intensive care units, we are not recommending those kind of procedures at this time. If there's extensive blood loss that is anticipated with the procedure, we're not recommending those. But otherwise, we are proceeding with many of our typically scheduled procedures, whether it be mammograms, colonoscopies, hernia surgeries, joint replacements, orthopedic procedures, ear, nose, and throat procedures, on and on. So we are going to be slowly bringing those on over the next few weeks. And again, on a week-to-week basis, we decide how many cases we can proceed with in the upcoming week based upon our supplies on hand, capacity, pharmaceuticals, and the like.
There were a couple last-minute questions. I think people heard we were about to wrap up, so they're throwing in a few last-minute questions. They want to know things about, I've been positive. Am I now immune? Do we know enough about the disease yet for that?
We don't know that. It is probable with other coronaviruses that you do have some immunity if you have a reasonable amount of the IgG, that antibody that kind of confers some immunity. But what we don't know at this point is what titer or what level of that IgG confers immunity, and if that immunity lasts for a few weeks, a few months, or lifetime. So there's a lot that we don't know about this particular pathogen yet. We do suspect that there is some immunity, and we're very hopeful. And having a successful vaccine, that will be a requirement for us to be able to develop. On a positive, it appears to be mutating very slowly or not, very significantly. So that's a positive note for developing a successful vaccine or conferring immunity. But more will tell as time goes on.
Mm-hmm. And time for one last question before we wrap up. With things opening, some of our scheduled procedures, there's been some more visitation questions. Can we clarify who is allowed to have somebody with them, such as somebody maybe with cognitive issues or a disability or something along those lines?
So essentially, we've restricted visitors, and except for extraordinary circumstances. So if there's a patient that comes and is going to be in the hospital who has a cognitive impairment, or has a need that they need to have somebody accompany them, then we certainly are looking at those on a case-by-case basis. And we have had situations where it's critical that somebody be with that patient when they're with us. When we look at our laboring moms, we are allowing one coach to be able to be with that laboring mom, and then to be the same person that can come to visit mom while mom's in the hospital. For end of life, our palliative and hospice providers are our gatekeepers there. So if we have someone who is at the end of their life and they're here with us at the hospital, then we're asking that we consult with our hospice and palliative team for them to be able to work out with loved ones what we're able to do as far as allowing some visitors to be able to be here for those last days or last moments of someone's life. So it's a very restricted situation, and I will tell you it's probably one of the hardest things that we're dealing with across the hospitals outside of the direct COVID piece, because it's really hard for people to be in the hospital and not have their loved ones with them. It's also really hard to be a loved one and know that your family member is in the hospital and you can't see them, and we understand that. And I actually have an apology for somebody from the last time we did a town hall. I talked about how nurses were doing a good job of reaching out and connecting with family members every day. And when somebody commented that that wasn't true, that they didn't have that experience. And I apologize for that, because we did then go back and reiterate it across all of our nursing units. And I feel of a much higher level of confidence that nurses are taking painstaking efforts to make sure that once a day, at least once a day, they are contacting the loved one of a patient to provide an update. But we know that's not the same as being able to be physically present with your loved one. And so we've done a lot of things and using a lot of tools. And Mike mentioned, technology. So we have an app called Jitsi. We can use video conferencing. So many different ways that we can try to make it easier for there to be a connection between the patient and their loved one. And so really trying to pay very close attention to putting ourselves in the position of that patient or of that family member, and what would that be like, and how can we do our very best to make sure that they have those connections. So we do understand that it's very difficult. It's difficult for the nurses and the caregivers also, because they're taking the place of family, and we know that that's not the same. And so just making sure that we do everything that we can. I shared a story earlier. I was walking past a patient room the other day, and I heard voices. I heard a patient, it was an elderly woman, and I heard a younger woman's voice, and they were cackling and laughing, and I thought, oh, there's a visitor in there. Who let the visitor in? And I peeked in the room, and it was the patient holding an iPad and rubbing the iPad. And the person on the iPad, it was a FaceTime visit, was her daughter, and she said, I'm touching you, I can see you, I can touch you. And so that really made such a big difference to that patient and to that daughter in the moment. We can do those things. And so it is hard to not have visitors, but we're trying to do everything we can to fill in that gap.
Thank you, Eileen. And I think it's time for our closing thoughts. So Dr. Newman, I'd like to start with you.
Yeah. So just the first thing I want to say is a shout out to all of our nurses. Next week is Nursing Week. And, I think at normal times, it's hard not to have a great admiration for the nursing profession, but, just profound admiration for the nursing profession as they've stood on the front lines as we face this enormous pandemic and challenge. Nurses are highly educated, trained, and skilled professionals who dedicate their lives to the caring of others. And I just am very grateful for our nurses here at Mary Washington. Thankful for the leadership of Eileen Doman, who's just been fantastic throughout this, as well as our other nursing leaders, Tanya Thigpen and Deb Marinari at our 2 hospitals, and many others throughout. So number one, I just want to give a shout out to our nurses. And then number 2, the loss of life from coronavirus has been truly tragic. Tens of thousands of Americans have lost their lives in the last couple months from this pandemic. But what I don't want to be the second tragedy is a larger number of Americans dying from avoiding health care or being afraid to seek health care. And when we look at the number of folks dying at home and we look at our numbers here in our emergency departments, I think that's a very, very significant concern. So our hospitals are safe. Please do not delay or defer care, particularly for life-threatening emergencies like heart attacks and strokes. Please seek care when it's necessary.
Thank you, Dr. Newman. Eileen, closing thoughts?
Well, I'm going to build on Chris's well wishes, so thanks, Chris, for the wishes. But yes, next week is Nurses Week. This year, the World Health Organization and the declared this is 2020 is the year of the nurse and the nurse midwife. I don't think we needed to have a pandemic to celebrate it, but it is a very special year, and we're happy to have it be the year of the nurse. And so I actually have a challenge for all of you in the community. So for those of you that know a nurse, next week is the time to let them know how much you appreciate them, because I couldn't agree with Chris more. Nurses are highly educated, highly talented, and they give every single day. So if you know a nurse, then do something special for that person next week for Nurses Week. And if you're lucky enough to know a Mary Washington healthcare nurse, then please make sure that you do something special for that Mary Washington healthcare nurse. I'll tell you a fun story. In my neighborhood, somebody started by painting rocks and writing a word of inspiration on the rock. And so I left my house one morning and looked over in the garden, and there was a rock that said devoted. And I look at that rock every day, and that means something to me. So the littlest things can mean a lot to a nurse. So again, if you know a Mary Washington healthcare nurse, you know somebody very special. So please join me in doing something nice for them next week to say thank you and to let them know how much we appreciate what they do every day.
Thank you, Eileen. Dr. McDermott, closing thoughts.
Great. I'm sure there's a lot of our associates and team members who might be tuning in. If that's the case, if you could take a minute just to call over your children, your spouse, your significant other, just have them come join you real quick on the screen. And while they're coming over to join you, I just want to thank my wife, Chrissy, and our children for the support that they've given me. This has been challenging times. I know there have been extra demands placed on me and our family as I've been called to help make sure our community has the care that it needs going through this COVID crisis. And so for all of our teammates out there and our associates and family members who might be watching right now, I just want to thank you for the support that you are giving your loved one, our teammate, for everything that they're doing, right? You're giving them the support they need to come and care for our community. They are heroes coming into work here every day, making sure our community is cared for. And thank you for sharing your loved one with our community and for the support that you are giving them during this time. Thank you very much.
Thank you, Dr. McDermott. On behalf of Mary Washington Healthcare, thank you to our panelists for providing your expertise this evening. Thank you to all of those who have been watching this evening and commenting and sending their love. A lot of love comments tonight. To continue receiving the latest local COVID-19 information, stay tuned to the Mary Washington Healthcare Facebook page and visit us online at mwhc.com. And be sure to visit give.mwhc.com to learn more about how you can support our associates. Good night.
Good night.